Good morning.
Good morning.
I'd just like to say I am Dr. Geraldine Hayes Nelson, and I am the president of the Portage County NAACP. And joining me,
Good morning. I'm Latrice, Dr. Latrice Snodgrass. I am the third vice president and health chair of the Stark County NAACP under the leadership of President Hector McDaniels.
and we would like to extend a very special thank you to all who have joined in this wonderful partnership as Stark County and Portage County NAACP joins in addressing COVID-19 vaccine hesitancy in our communities.
Right.
This event is sponsored by the Ohio Department of Health and the Ohio Conference of the NAACP, the oldest civil rights organization in the nation. Please feel free to type your questions in the chat. And if you're new to this platform, it's very similar. You'll see the chat box. But please, once all the speakers have spoken, we will have a chance and a time to answer any questions that you may have for our panelists. At this time, I'm going to turn it back over to Dr. Snodgrass.
So we know that there have been several vaccination hesitancy town hall discussions, roundtable discussions. Today's event is a bit different, as the goal of our event today is to train community partners and leaders to become health ambassadors who will help increase knowledge and awareness of COVID vaccination in hopes of increasing the actual vaccination numbers within our communities. So with that, we'll go ahead and we'll begin the program with Mayor Thomas Burnaby, the mayor of Kansas City.
We all set. Good morning, everyone.
Good
Good
morning.
morning. Welcome to Canton and Stark County, Ohio. And I thank you very, very much for making me a part of this very prestigious panel to discuss these very, very important issues today. I want to emphasize that as mayor, I do not bring the level of medical or public health expertise as many of the talented panelists that you have with us this morning. My comments are therefore relatively short. I really would like to emphasize from a personal perspective my own personal choice as a husband, as a father, as a grandparent, to get my entire family vaccinated and to get myself vaccinated. I am almost 75 years old. I'm getting up there. The risk, of course, of COVID to people in my age and even younger categories has been very, very serious. I have received my 2 shots, and I am really, really glad that I did. And I want to emphasize that to everyone. I still mask and I still socially distance, but I feel so much safer in public. I want to visit my grandchildren who live in California, and I haven't seen them for about 14 months. And now I can, as a result of getting the vaccination. But both personally and as mayor, I know the terrible, terrible power of this disease. My wife, Bibi, had it. She was very, very sick, but she was not hospitalized. But I also know statistically the terrible national numbers and the terrible toll nationally. And also, and very, very importantly for today's discussion, the disproportionately large toll that is taken on our African American and minority communities. As mayor, I have attended many meetings nationally on this subject. The absolute consensus of mayors across our country and of the physicians and of the public health experts that are part of these many, many meetings is simple and direct. And that is, for your own health and for the health of your loved ones, please get vaccinated. I also want to emphasize that if in doubt, please do not rely on social media or gossip for the facts associated with this. And that's part of the purpose and the important purpose of today's discussion. But please call your family physician, the same as you would do with cancer or heart disease or any other serious illness. That is my message. And again, I thank you for the opportunity to talk to everyone this morning.
Thank you, Mayor Burnaby. Thank you for your time, and thank you for those enlightening words and encouragement to the community.
And before we have our panelists, we also have joining us this morning is our state Conference President, Mr. Tom Roberts, and he's going to bring greetings on behalf of the state of Ohio, Ohio chapter of the NAACP.
Well, thank you, Dr. Geraldine Hayes Nelson and Dr. Snodgrass and Dr. McDaniels for hosting this very important conversation today. I want to thank the mayor for his words, because what he was talking about is very, very important for your community here, from leaders like your mayor, the importance of getting the vaccination. The work we are doing in Ohio with Train the Trainer in collaboration with the Ohio Department of Health is very important. It's historical and meaningful. It's what David Sinclair said when he said, find a need and endeavor to meet it. And that's what we're doing in collaboration with the Ohio Department of Health. We are intentionally training people to be ambassadors in our community, to share with you the importance of getting the vaccination and importance of making and sharing with other family members the importance of getting the vaccination. I got both of my vaccination shots and I have no after effects, and I'm feeling great. As a family member, we are now able, and I have come from a small family of 10, 7 boys and 3 girls. We are now able as a family to celebrate my mother's 98th birthday on April 21st. So I'd encourage you to call people who you know need to hear this message from the panelists today so they can join in and hear this very important information. You will receive very important information for your community, for your family, and for everyone else that you love in this community. So let me just congratulate the units for doing this very important work and creating you as new ambassadors to carry out the work of what NAACP has been about for over 100 years. Good luck and God bless, and I'll see you all soon. Thank you very much.
Thank you.
Thank you, President Roberts. And now Dr. Snodgrass is going to introduce our panelists.
All right. So I want to take a cue from the back team. I believe we have Chief Jamie Carmichael, and I would like to go ahead and offer him the opportunity to speak next.
Hello.
I'm so
Hi. It's okay. I am named after a James, so that's fine. How are you? Hello, Dr. Nelson and Dr. Snodgrass. I'm very glad to be here with you all today. This is really important work. I want to echo what Mayor Barnaby and what President Roberts just shared about this really being an opportunity not to get back to normal, because far too many of us are gone from our communities and our homes because of this disease, but to get back to life, to get back to engaging in our communities. And there is a lot of work to do in our communities. My name is Jamie Carmichael, and I am the Chief Health Opportunity Advisor for the Ohio Department of Health. And that's actually a new position. And it's really focused on health equity. It came about as a part of the Governor's Minority Health Strike Force report, which basically said what many of you know and what our host here at the NAACP know, which is that inequality, racism, discrimination, exclusion, all of those things have led us to a less healthy community for African Americans across the state. And not just African Americans, but other vulnerable individuals and minorities as well. And so when this disease came along, we were already pre-positioned, we were already set up to really be devastated by this. We have higher rates of chronic illness. We live in, more likely to live in multi-family households or multi-generational households, more likely to be in crowded urban spaces, less likely to have access to green space for recreation. And so many of those things, lack of access to healthy food, lack of access to transportation, they all compounded the impact of COVID-19 on our communities. And what that has done give us an opportunity to start to think about how we address health further upstream. We can't wait on another pandemic to get worked up and excited about protecting African American health. We have an opportunity right now to help make all of our communities healthier. We start that today by taking advantage of this vaccine. I was listening to a story on NPR this morning, and they shared how even worldwide, globally, there's an equity in how this vaccine is being distributed. And I bet you can guess that Black and brown countries are less likely to have access to this drug. In the United States and in Ohio, there are a lot of people working really hard to make sure that this drug is accessible for everyone. We have an opportunity. It is a blessing. We have a responsibility to get vaccinated, to help the people we care about get vaccinated. So if you want to be a part of the solution, if you want to start to spread good messages and truthful information to your friends, families, and networks, please visit coronavirus.ohio.gov. When you go to that page, right at the top in the center, there's a tab and it says equity and high risk populations. You can click on there. There's a communications hub. And actually the NAACP, this communications hub came about because of a meeting we had with President Roberts, who just spoke a moment ago. And it was actually his idea to compile all of these communication resources in one place so that citizens, leaders, our community advocates, small business owners, coaches, everyone could participate in spreading this good message. So go to coronavirus.ohio.gov, click on that equity and high risk groups, go to the communications hub, find a social media post, find a myth versus fact sheet. We have video in multiple languages with people who look all kinds of ways. So I just want to invite you to be a part of getting us back on track and helping our communities to become safer and healthier. And I want to thank you for being here today and for your time. Thank you.
Thank you so very much. At this time, we will hear from Christine Smith, who is a Stark County City Council member. I often refer to her as the unofficial mayor of the city because everyone knows Christine. So without further ado, can we bring Christine to the stage?
Good morning. Good morning.
Okay, technical difficulties. We will definitely bring Christine back though. So now we will bring forth James Adams, who is the Kansas City Health Commissioner. Good morning, Jim.
Good morning, Dr. Snodgrass. Thanks for the opportunity to say a brief comments about how we're trying to address vaccine hesitancy and also equity in vaccine distribution in our community. As Jamie pointed out, we started working with her early on when they were designing a program in Ohio to distribute vaccine to our communities with an eye towards equitable distribution. So we've known for a long time that racism has played a key role in the disparities in health equities that we observe, especially by what we would call race. We started a journey about 10 years ago working on infant mortality. And that started us with being able to develop some very strong relationships within our community to help work on infant mortality. And those relationships, I think, have stood us up in good stead as we started working on equitable distribution of vaccines for COVID. So we have a program where we try to work with community partners to provide opportunities for scheduling for people that would have limited technical capabilities. A lot of the scheduling systems, we tout automatic scheduling and going to the website and things like that. And, we know that certainly older adults in our community and people that have limited access to the internet or more modern cell phones may have trouble scheduling those things. So we work carefully with a scheduling partner that we have. We've also developed strong relationships with the NAACP. We've helped our local chapter with some data surveys to find out about vaccine hesitancy and things like that within the community. We've also worked with our Urban League and with some Latino and Latinx outreach partners to help reach into the community and provide opportunities for the scheduling that these folks so desperately need to get into our clinics. We have hosted clinics at a variety of locations. I'm actually at a clinic here today at our Lehman Middle School, which is in the northwest part of Canton. We have held several clinics in the southeast part of Canton, which is a historically Black neighborhood, one of Chris Smith's Ward 4, can't go without saying that, areas. And so we've had opportunities for vaccinations in those areas also, as well as our health department. So the important thing for us is to make sure that we are making sure that we have the opportunity for scheduling of appointments that people would traditionally get shut out because of that process. I would say that what's important for us is the development of long-term and lasting relationships with the community so that we can work together in meaningful ways to address vaccine hesitancy. So it's going to take all of us to work through this. And I'm very glad that the NAACP is providing this Train the Trainer program so that we can further reach into the communities, particularly the Black community, to make sure that we get vaccines out in the community quickly and safely. Thank you very much.
Thank you, Jim. Have a good day.
Thank you.
All right.
Well, thank you. We've heard some updates and information from Stark County. And up next, we have Dr. Mark Arredondo, and he's with the medical director at Portage County. And so he's going to come and join us and share with us as well. Good morning.
Good morning. Thank you very much for this opportunity. It's such a privilege to be part of this panel, and I'm thrilled to share the information I'll be sharing here in just a minute. So I'm going to, if you give me just a second, I'm going to share my screen so I can present this information here, which is regarding the COVID vaccines. Can everyone see my screen there?
Not yet.
Okay, hopefully it's coming up soon.
There it is.
Great. So again, I'm Dr. Arredondo, and I'm the medical director of the Portage County Combined General Health District, and it's my privilege to be here to present information as part of the Train the Trainers for health educators and leaders of our communities. So the topics that I will be covering are the following. It's racial disparities in COVID-19 mortality, COVID-19 spike proteins, common questions people have about the COVID-19 vaccines, clinical trial, demographic information, COVID-19 vaccination percentages in the nation and Ohio, and lastly, COVID-19 vaccination disparities by race and ethnicity. So I'd like to start this presentation about the COVID-19 vaccines with a very sober reminder about why it's so critically important that everyone, but especially individuals of color, get vaccinated. This slide shows in very stark contrast the tremendous disparities in the death rates from COVID-19 based on race, even for those who are young and likely healthy, as you can see on the left-hand side of the slide. So the far left side of the slide is the ratio of death rates, and the bottom of the slide is,
sorry,
yes.
You haven't advanced the slide. We're still on your first slide.
Oh, my apologies. I have it in front of me that way. Give me 1 second. I'm going to stop sharing. Are you able to see? 1 second, please.
Okay.
Thank you for letting me know that.
No problem.
Are you able to see this slide now of the race gaps in COVID-19 death rates?
Yes.
Perfect.
Okay, great. I will leave it on this presentation here. So, so this shows the very stark contrast between the tremendous disparities in the death rates from COVID-19 based on race, even for those who are young and likely healthy, as you can see from the left-hand slide, part of the slide here. So the far left slide is the ratio of death rates, and the bottom of the slide is the age range from 35 to 44 years, all the way to 85 years and over. The dark blue color represents those who are white, the orange color represents those who are Black, and the green color represents those who are Hispanic or Latino. I'm going to go ahead and advance my slide here. So Do you see this slide coming up here with the current cases and death rates in the United States at the top right?
Yes.
Yes.
Okay, great. So this slide here shows the total COVID-19 cases, as you'll see here throughout the United States. This slide is here to show you again the disparities in COVID-19 mortality throughout the nation. As you can see in the bottom right of the slide, we have deaths by race and ethnicity. As you'll see, this is deaths per 100,000 residents. 105 for whites, 116 for African Americans, 111 for Hispanics, 74 for Asians, and 132 for American natives. So this slide here is to show you a picture of the SARS-CoV-2 virus, also known as the COVID-19 virus, which comes from a family of viruses called coronaviruses. So these viruses receive their name from the spike proteins, seen in this microscopic picture as the red triangular areas that are protruding all over the surface of the virus, which forms a sort of crown, also called corona in Latin, which is where we get the name of the virus coronavirus. I wanted you to see these spike proteins because the current COVID-19 vaccines work primarily by having our bodies produce these harmless proteins so that our immune system can quickly recognize and attack any viruses with these spike proteins, such as the COVID-19 virus. So here are the common questions people have about COVID-19 vaccines. How do the vaccines, COVID-19 vaccines work? What are the advantages and disadvantages of the two main types of current COVID-19 vaccines? How do I know that the COVID-19 vaccines are safe? And what is an emergency use authorization? What is the effectiveness of the COVID-19 vaccines? And what are the side effects of the COVID-19 vaccines? So there are over 100 COVID-19 vaccines being researched worldwide, and with over 60 of them currently in clinical trials. All the vaccines work by getting a message to our cells, so they have the information needed to recognize and kill the COVID-19 virus. The two main couriers used currently to get the message to our cells are the messenger ribonucleic acid, or mRNA, and a virus vector. So nucleic acid vaccines use a genetic molecule called a messenger ribonucleic acid, or mRNA, to send instructions to our cells on how to make virus proteins. These instructions are harmless to our body and never become part of our genes, and are destroyed by our cells within a few days. The COVID-19 mRNA vaccine send instructions to our cells on how to make spike proteins, which again are the harmless proteins on the outer surface of the COVID-19 virus. After our cells produce the proteins, called antigens, our body immediately recognizes them as foreign and mounts an immune response using antibodies and kills the viruses. Our immune system remembers these proteins, and if it encounters them in the future, our body quickly eliminates them. The Pfizer, BioNTech, and Moderna vaccines are two examples of nucleic acid vaccines, and they're authorized to be used in the United States. Virus vector vaccines use an inactivated, modified, and harmless virus to deliver the instructions to our cells, called a vector or carrier. An example of a virus that has been used as a vector in other vaccines are the vaccinia virus, which was used in the first ever vaccine against smallpox, also used in polio and some flu vaccines. Virus vectors are currently being used in vaccines for the measles and Ebola. Johnson & Johnson uses an inactivated, modified, and harmless adenovirus, which is a common virus that typically causes mild cold symptoms in its natural form. Johnson & Johnson, AstraZeneca, China, and Russia have developed virus vector vaccines, and they're currently in use. Only the Johnson & Johnson vaccine is currently authorized to be used in the United States. So what are the advantages and challenges of the two main types of the current COVID-19 vaccines? Well, regarding the mRNA vaccines, which again are the Pfizer and Moderna vaccines, the advantages is they can be quickly designed and inexpensively made and modified. This is one of the reasons why they were among the first COVID-19 vaccines to be available. mRNA vaccine research has been ongoing for years for use against other viruses such as influenza, Zika, rabies, and cytomegalovirus. It's also being used in cancer research to potentially target specific cancer cells. Here are some challenges regarding the mRNA vaccines. The instructions passed on to our cells are for just a small portion of the virus, such as the spike proteins in the COVID-19 virus, which limits our immune response after the first dose and requires a booster or second immunization for a full immune response. After the first shot, the Pfizer and Moderna vaccines require a booster 21 and 28 days later, respectively. The mRNA molecules are very fragile and quickly fall apart at room temperature, requiring transportation and storage at very cold temperatures. The advantages of the virus vector vaccines, which is, for example, a Johnson & Johnson vaccine, is the ability of the virus vector to infect cells, provoking a strong immune response, and therefore often only require one shot for full immune protection. Johnson & Johnson's vaccine, for example, only requires one shot, They are a known technology and have a safe track record. They can often be used in people with weakened immune systems as well. Here are some challenges regarding the virus vector vaccines, again, about Johnson & Johnson. Some challenges is that pre-existing immunity to the virus vector or carrier could reduce the vaccine's effectiveness, meaning that the body could raise an immune response to the virus vector itself rather than to the target virus. They typically take longer to produce, which makes them less cost-effective. So how do I know that the COVID-19 vaccines are safe, and what is an emergency use authorization or EUA? So the COVID-19 vaccines go through each and every step of the research process for other vaccines and have been carefully studied in clinical trials. The findings were evaluated by independent oversight groups along with the Food and Drug Administration, and the results are found to be valid. The safety data showed an acceptable safety profile, and there were no serious safety concerns identified. In addition, safety will continue to be an ongoing priority. Data will be assessed as people are vaccinated, and the vaccine trial participants will be followed for 2 years. Let's talk a little bit about the emergency use authorization. So an emergency use authorization, or EUA, is one of several tools the Food and Drug Administration uses during public emergencies to ensure medical products are quickly available when there are no adequate, approved, and available options. Due to the severity of the public emergency, these products are authorized based on the best available evidence, with special care to make sure that the benefits outweigh the potential risks, and without waiting for all the evidence that would be needed for a lengthy FDA approval or clearance. EUAs can be revised or revoked by the FDA at any time, as they continue to evaluate the available data and patient needs during the public health emergency and are in effect until the end of the emergency declaration. So let's now talk about the effectiveness of the COVID-19 vaccines. So the Food and Drug Administration requires a minimum threshold of at least 50% effectiveness in preventing COVID-19 for them to consider approval of any COVID-19 vaccine. Pfizer and Moderna's vaccines not only met that minimum threshold 2 weeks after their first shot of at least 50% effectiveness, which increased to 95% 2 weeks after their second shot in clinical trials. Recent studies of Pfizer and Moderna being given to individuals living in areas with high rates of variants or mutations of COVID-19 have actually shown 80% effectiveness 2 weeks after the first shot and 90% effectiveness 2 weeks after the second shot. The Johnson & Johnson vaccine has also exceeded the minimum threshold and has 66% effectiveness against moderate to severe infection and 85% effective against severe infection 2 weeks after the one and only shot. So let's talk about side effects of the COVID-19 vaccines. So all vaccines can cause side effects, including those against COVID-19. The benefits of protecting individuals from both the short-term and long-term effects of these severe diseases, along with potential hospitalizations and death, far outweigh the risks and side effects of the vaccines. This is especially true for COVID-19 with its high rates of hospitalizations, deaths, and potential long-term complications such as brain fog, fatigue, heart, and lung problems. Not only were the COVID-19 vaccines highly effective in clinical trials in preventing participants from getting COVID-19, but in the small percentage of trial participants who were vaccinated and subsequently infected from COVID-19, they had significantly milder COVID-19 symptoms as compared to those who received the placebo. There were no hospitalizations or deaths in any of the vaccine trial participants. This is a comparison table of general side effects percentages for Pfizer, Moderna, and Johnson & Johnson COVID-19 vaccines. As you can see here, the side effects start from the pain injection site is the most common, all the way down to nausea and vomiting being the least common. And as you can see here, they're pretty similar between Pfizer and Moderna and somewhat similar to Johnson & Johnson. Older participants, by the way, had milder symptoms compared to younger participants for all side effects in all trials. Briefly, here are some clinical trial demographic information for Pfizer based on race and ethnicity. As you'll see here, it's about 82% white, about 10% African-American. Move on to the Moderna. So it's about 80% white again, and about 10% for African-Americans in terms of race for the clinical trial demographic information. For Johnson & Johnson, it is about 62% white and about 17% African-Americans. Last, we're going to be ending with some information about the COVID-19 vaccines in terms of total doses administered, numbers of those individuals received a first dose and those who are fully vaccinated. You'll see the percent of the U.S. population that's partially vaccinated is about 14% currently. The percentage of the U.S. population fully vaccinated is about 20%, and percentage of the U.S. population that received at least one dose is about 34%. Here's a breakdown of the percentage of the population partially vaccinated with one dose received, and what it looks like based on darker colors being the higher percentage. And you can see here in the United States that about 14% have been partially vaccinated across the United States, and the percent that's fully vaccinated is about 20.5%. This is for across the United States for 2 doses received. This is for Ohio specifically. You will see that the percent partially vaccinated in Ohio is 13.2% compared to 13.9% in the United States. Percent fully vaccinated is 20.8% compared to 20.5% in the United States. And here is some statistics about Portage County. Specifically, we're looking right over here. People vaccinated with at least 1 dose is about 31.87%, and people fully vaccinated is 18.12%. You'll see how it started in the time period. Lastly, this is the end of the presentation. I'd like to end with this slide regarding COVID-19 vaccination by race and ethnicity. As you can see here, in terms of the population, you'll see the color white here. Whites are the color blue on this circle. African Americans are purple, Asians are black, and Hispanics are yellow. And this is fully vaccinated. So you'll see a large percentage of the white population has been vaccinated as compared to, say, 13% of African Americans. And then the fully vaccinated is about 8% for African Americans. So regarding under-vaccinated populations, Hispanic Americans make up 18% of the population, but only 8% of the fully vaccinated. African Americans make up 13% of the population, but only 8% of the fully vaccinated. All right, here are my resources, and thank you very much for your time. And do you have any questions?
Thank you, Dr. Arredondo. We look forward to bringing you back for the roundtable discussion. I'm sure there will be several questions at that time. That was a phenomenal presentation.
Thank you. And I believe that we are going to just pause because I think we do have Christine Smith from Stark County City Council. And we want to give her an opportunity to say a welcome, and then we'll resume with our panelists. Good morning, Councilman.
Good morning. Good morning. I am so sorry that I had so much difficulty. And I'd like to say to Latrice, you know, you gave me that name of being affiliated with the mayor. As you can see, I am the mayor at this particular time. No, I'm in his office. So I'd like to say thank you so much for inviting me to be on this panel. And I am very, very glad to be a part of this community and to get the word out about the vaccination. You know, it is very important, and especially in my community, because I serve a community that's vastly low income, sort of the minority of the city. But it is important that we get vaccinated. The majority of my residents are low income and high rise senior citizens, but we've had a great response in getting the vaccinations out. Our health department and our administration has played a grand part in doing that because we have them coming to our senior high rise buildings and delivering the vaccinations to them. We also have our Southeast Community Center where it is housed also for vaccinations. And it has been very, very helpful in that community. I did want to share one thing. I don't know whether everyone know or not, but we have an African-American female scientist that was instrumental in designing the COVID vaccine, which was the Moderna. And she's out of North Carolina. Her name is Dr. Corbett. So as you can see, African-American played a great part in the vaccine. Now, did I go too far, or was I supposed to stop here, or what was I supposed to do at this particular time? I know I went on and on and on because I was so anxious about getting on, and to where I just went on doing what I was doing. So what am I supposed to be doing now?
You did exactly what we needed you to do, Christine. Talk to us about, from your community perspective, what's being done to, you know, increase the rates of COVID vaccination within your ward and within the city, just your personal perspective. So,
well, you know, not only is the vaccine important, healthy living and healthy education in our communities are so important also. And I say that with healthy education, healthy eating. And so, you know, you might remember, Latrice, we have a disparity, which is in our grocery store, but pretty soon that's going to be a great asset to our community, which will encounter that healthy eating. And also the Southeast Community Center, we house there where we give out food every other week. And we also have a health clinic that's coming. So we play a very, very important part in this community. I serve about 4,000 residents in that particular area. And whenever I get a chance to talk about a lot of the goodness and the greatness and the healthiness that's coming to our community, I try to do that. That's why I'm so glad that you had this forum this morning, so that I can just sort of toot my horn about a lot of the great things that's coming to my community and the 4th Ward and the city of Canton. So I am very thankful for that. I'd like to also thank Mr. Jim Adams, because he made sure that those areas that was lacking a lot of sort of transportation and getting out to get those vaccines were made aware as to where they can get them. So I am just very excited about that. I've had my 2 shots and I didn't have any type of anything happening to me other than I think I feel better. And so I just want to let everybody know that to please get out and get those shots. If there's an issue with you getting there, we have no problem with you getting there. We will even bring the shots to you. So in my community, this is very, very important. So, you know, I just want everybody to know to please, please get those vaccinations and get them soon so that we can get back to doing a lot of things that we were doing before, but we still have to play it safe. We still have to wear our masks and we have to keep the crowd sort of low. So please just do your part and get out to get those vaccines.
Thank you, Christine. Thank you so very much.
Awesome.
Thank you. And I'm so sorry with all the difficulty that I had, but I think once you named me mayor, it was no problem because the mayor came to the rescue. All right. Thank you.
Thank you, Christine. And Chris touched on that accountability component, and Dr. Nelson and I, you know, it was very important to us when we talked about bringing your A game, that access, but that accountability is very, very important. So we have to be accountable for ourselves. So thank you, Christine, again, for those words around accountability and access.
Yes, and I've heard some of that, and we're going to be talking a little bit further about some of that continued partnership that Council Lady Christine has been doing with the Urban League. And so you're going to hear a little bit more about the programmatic. But now we have 2 doctors, and
there's been a slight change. Dr. Minot is running a little bit late. So, but that's okay. We're going to go ahead and bring up Jessica Bowley from the City Health Department, the city epidemiologist.
Okay.
Oh, she's here now. Okay, so you know what? Let's stick with the agenda. Let's go ahead and bring on Dr. Minot. We'll get Jessica after the doctors.
Okay. So we have Dr. Howard Minot, who is, well, he's right there. We're going to let him introduce himself. And we have a tag team here. And so you've heard a little bit about the statistics, and we've talked about the vaccines. We also want to talk about, and Dr. Minot's going to be sharing as an internalist doctor of some of those, the impact on the Black and Brown with COVID-19 as it relates to COVID-19.
We can't hear you, doctor.
And so while they're working on Dr. Minot, we want to say a very special thank you. We have, as you can see, we're wearing some special colors here. So we do want to say, we do have the Delta Sigma Theta, okay, that have joined in, and we want to say a very special thank you to the Pro League of Stark County, ladies of Alpha Kappa Alpha Sorority Incorporated, who have also joined in, and thank you for joining in this morning. And the Minots, I think they were ready. We were getting, okay, there she is.
I wonder if we can hear. Good morning, Dr. Minot.
This is Dr. Melody Minot.
Still can't hear her. We can't hear you. So technology is great when it works, but that means that we are doing some great work, because when you're doing good things, you get snags along the way, but that's okay. We will keep things, we'll keep things moving along. So it's
Jessica's here, but I just see in the chat that Zeta Phi Beta has joined, and we want to say to the Zetas, our sisters, thank you for joining in this morning. And so our Black Greeks are joining in and supporting the work of what is happening here in Portage and Stark County. So thank you.
Thank you, Dr. Thank you, Jamie Carmichael, Zeta. Yes, we have to shout you out as well. D9, thank you so much. Okay, we have Jessica now.
Okay.
Hi, good morning, everybody. I apologize for the technical issues.
Okay.
Like Jim said, we are both at Lehman Middle School today doing a vaccination clinic. So first off, thank you, Dr. Snodgrass, for including me in this conversation today, and for the NAACP for having these conversations. So a little bit about me. My name is Jessica Boley. I am the epidemiologist with Canton City Public Health. I specifically work with the Thrive program, which is focused on infant mortality. So if you know, our Black African American infant mortality rate tends to be way higher than the average. So the goal that we work on with that project is to improve the birth outcomes for our African American Black community, so that every baby can celebrate their first birthday with their families. Epidemiologists, we have a big role in general. Before the pandemic, I think a lot of people did not know what an epidemiologist was or what we do. But we have a wide range of expertise. We have epidemiologists that deal with violence and predicting violence. We have epidemiologists that work with traffic and car accidents. We have ones that focus on infectious disease, on birth outcomes, cancer clusters, things along those lines. So it is a wide range of expertise that we have in the field of epidemiology. So I'm glad to be amongst many, many amazing people. So what I really wanted to give you guys all is some information, not only on Portage County, which is my home county, but Stark County, which I also consider my heart home county for the past 10 years. All this information on population is available from the Ohio Public Data Warehouse. You're able to break down by age groups, by individual ages, by sex, gender, everything like that. So just a little bit about Portage County for those who may not be aware of the population makeup of Portage County. Overall, there's just over 162,000 people in 2020 in the population. Blacks or African Americans actually make up just 5% of that population. I was surprised by that percentage. Again, I live in Southern Portage County, and I actually didn't even think that there was it was that high. So 5% of the population is Black or African American, just over 9,000 persons. And if you are aware of what how the vaccine rollout has gone, we started with pretty much 65 plus. And in Portage County, that accounts for 8% of the African American population. So as we're talking about the percentage of persons that have been vaccinated, or at least vaccinated started, amongst each age group and amongst each demographic, we also have to, consider how much of that population actually was eligible up to a certain point, and how much of the population that that demographic particularly accounts for. As of last week, pretty much it was 16 and over. I know Portage County is doing a great job at Kent State University and utilizing their nursing program to be doing mass vaccination clinics up at the university. And so in Portage County, we have just over 76% of the African American population is now eligible to be receiving their vaccine. As of yesterday, 4/9, just over 1,400 Black African American persons in Portage County were vaccinated. So about 21% of those that were eligible. Portage County, I will tell you, you're beating Stark County. In Stark County, we have a population of just over 370,000 persons, with Black or African American making up just about 9.3% of the population. Of course, whenever we come to our city center, Canton City, we're close to 20%. But again, those over 65 in our Black African American population was just close to 12% of the population, and was just was the majority group that was eligible up until a few weeks ago. So far, if you actually look at anyone over the age of 16, again, in Stark County, that is not eligible for the vaccine. It's about 71% of our African-American Black population in Stark County is now eligible, because we have about 29% that is under 16. And so far for Stark County, just over 4,000 vaccines have been started in the Black African-American community, so about 18% of eligible. So like I said, we're a little shy of what Portage County is doing so far. So kudos to Portage County and their health department, both at the city level. So just some limitations that I do want to discuss with you all that we do here at the local level whenever we're running these clinics. Some people do choose to not identify race for every gamut of reason. There's rumors out there that if you check that you're Black or if you're Hispanic, that you're going to get saline in your vaccine and you're not going to get a true vaccine. So those are all things that we are working on. But so some have chosen, whenever they fill out their paperwork to come to get vaccinated, they have chosen not to identify race. In Stark County, about 7% of those that have been vaccinated, the race is entered as unknown. And for Portage County, about 4% is entered as unknown. Some people can also choose to put other or check multiple races. Whenever they do check multiple races, in the ODH dashboard, we are able to see multiple races. But again, we don't see the breakdown of what those races are including. So again, if you have someone who is both Black and white and identifies as such, they would show up under both, under multiple. So the other thing that is important to us from a data standpoint and from an EBI standpoint is where people are actually coming from. So your address, your zip code is really important. Some of you may know that your zip code can depend your life expectancy. And so if we're not collecting that information and seeing where we need to focus our outreach, where we need to focus our resources, where we need to focus to improve that community, if we don't have that information, it doesn't help us as we're directing programs, directing outreach, trying to do clinics. We have a great show at our clinic on our southeast side, which we know is an area of Canton that has suffered from years and years and decades of disinvestment. And so whenever we go to Southeast community, it's so fantastic to see the community show up. So just, as you're thinking about ways to be able to improve vaccine accessibility and things along those lines, I am sure Dr. Latrice Snodgrass is involved in our outreach meetings. And so I am really looking forward to seeing what she's able to bring back to our next meeting, what was discussed in this group as to how we can improve the community that we serve, how we can improve our outreach, and not only for COVID-19, but for all of our programs moving forward. So thank you very much.
Thank you. Thank you, Jessica. Awesome. Now, we have heard those numbers and those statistics, and I will say I can say for our Divine Nine that's there in Portage and Summit County, we're going to be working on those statistics and helping. Again, we're just wanting people to have, just as you just shared, to be able to make informed decisions.
Right.
That's so important. Yeah. And so I just want to say that we want to make sure that people can make these informed decisions. Absolutely. And I know we have Dr. Melody Manat that's going to be joining with us, but Dr. Snodgrass, you were going to.
Yeah, I just want to say, I understand that there's some resistance to sometimes checking the box for your race or checking the box for your zip code, but that information is pertinent in helping us deploy the appropriate resources, deploy the appropriate tools and resources and people to the communities that are in the greatest need. So if you could please just try to get past that and enter your race, enter your zip code, because that's going to help us as we look at equity clinics and things of that nature. There's nothing fishy behind it. We need those demographics and that data to do the work that will cultivate change.
Yes. And I just want to say, and I'll get out there to Southeast. I had the Gear Up grant there in Stark County, working with our young people, and did a lot of work out of the Southeast Community Center. So we're going to get out there. We're going to work with our community and we're excited about the work that can be done. But we also have some people, some boots on the ground. You've heard from the medical field. Now we have two doctors, and so proud that we have Dr. Howard Minot, and he's going to come because he's working around. He is still out and still doing surgery and still practicing and doing all of that good stuff. So Dr. Minot, and then we'll also be joined by his wife, who is a psychiatrist, Dr. Melanie Minot, who's going to talk about the psychological impact of COVID on our African American community. So Dr. Minot,
Good
we'll start
morning and
with you.
thank you. I'm sorry for the technical difficulties, but what I wanted to do today was to give you a personal and clinical perspective as to the impact of the COVID-19 virus on our community. Just a little bit of a background. I am a urologist. I've been practicing in Portage County for 36 years, but I've always had a keen interest in public health. And so I serve on the board of medical directors of the Portage County Health Department. And my dive, if you will, into the COVID-19 was the impact that I saw in the hospitalized patients. As you know, and has been said by many of the previous guests, there's a disproportionate effect on Black and brown people of COVID-19 virus. We seem to get the disease more frequently because of the environment in which we live, which is more of a crowded environment. We also have multi-family dwellings, which tends to increase the spread of this virus. And when we do get the virus, it's much more severe in Black and brown individuals than it is in Caucasians. It has a devastating effect that I have seen personally in patients that are hospitalized. I mean, we die at a much higher rate than the Caucasian population, and also have a lot more post-COVID syndrome effects, the brain fog, the recurrent headaches, the lung and pulmonary complications from this are all very, very devastating to our community. So I thought after seeing this in the hospital that I had to do something to reach out to the community, because I understood that the patients and their families that I spoke with had serious misconceptions about taking the vaccine and really didn't understand that how important it was to have vaccinations. So we tried to quell some of the misperceptions that people had. And what we did was we partnered with the Portage County Health Department and also with the community centers that primarily served the African American community in Portage County. And we instituted a vaccine program in the Skeels Matthews Community Center, which again was a community center that provided services mainly to the African American community. And my role in that vaccination program was to reassure members of the community, and also a lot of these were patients of mine, that I took the vaccine. You know, I didn't grow horns. I didn't have the government finding out where I was. I mean, I've heard all these different types of, again, misperceptions that people have about this vaccine. You know, if you're African American, you're not going to get the correct vaccine, or if you identify yourself, you're going to get a fake vaccine, or it just went on and on. And so I felt that we had to do something to stop these preconceptions. And so the vaccine program was quite successful. We did end up vaccinating close to 400 people in the programs that the Portage County Health Department, in partnership with the community center did. And it was a very successful program, and we're happy that we've done it. And we've been asked by some other communities to, help or using the model that we used to help institute programs of a similar kind in their communities. Now, I know that we're running behind, and I'm going to turn this over to my wife, who is a psychiatrist, and she will be discussing the psychological impact of COVID-19.
Okay.
So we're going to just move the cameras here, folks, and I'll get out of the way, and she will get in.
Good morning.
Good morning.
Good morning.
Oops. Good morning, everyone.
Good morning.
Shall I go on now?
Yes.
You're there. You're live. We're watching you.
All right, good. Thank you. There are many things that confront people who are faced with COVID and all it implies. I'm going to give you the top 7 questions that I hear. Is it real? Can it affect me? Will it be that bad? Should I take the vaccine? Can I, as a person of color, trust the vaccine? And what happens if I don't take the vaccine? How will my life change after COVID? To answer the first question, many people still think the coronavirus does not exist. Even now, patients in the hospital on respirators still question whether they really have COVID. The virus has been identified and the symptoms have been well documented. Coronavirus exists. Number 2, can it affect me? Yes. We have not found anyone who has a natural immunity to COVID. At best, you could be an asymptomatic carrier or someone who does not show the symptoms of the virus, but you still can spread it to others. Question 3, will it be all that bad? Some people have said, well, so I'll catch the virus and I'll be done with it, as if it is a cold or the flu. Yes, you might be one of the lucky ones, but more than likely you'll develop symptoms which might lead to death, unfortunately. And we have over 500,000 people, souls in this country who have already died. Number 4, should I take the vaccine? Should I take the vaccine? The answer is unequivocally yes. Millions have taken it and have tolerated it well with minimal side effects. It will not only protect you, but the people around you as well. Number 5, can I, as a person of color, trust the vaccine? We have a long history with plenty of reasons not to trust the medical establishment. In the infamous Tuskegee experiment, Black men were singled out for this experiment about the effects of untreated syphilis. We have seen or heard of examples of different levels of care being given to people of color. This was one of the many reasons that my husband and I became doctors, because we wanted to do our part to serve the community. This is why we are standing here today telling you that you can trust the vaccine. These batches of vaccines are being given to anyone, regardless of sex or race. I took Pfizer, my husband took Moderna, and we are still standing. The only thing tracking any of us, folks, are our cell phones. Number 6, what happens if I don't take the vaccine? Well, you put yourself and you put your family and friends and others at risk of contracting COVID and even dying from it. I'm going to adjust my camera. This might be a little bit better. None of it's good. How will my life change after I get COVID? You may be one of the lucky ones who have no after effects at all. But more and more, we are seeing patients develop long-lasting symptoms affecting their lungs, their hearts, and their ability to think clearly These people are called long haulers. The reason for this is because your body mounts an inflammatory response to the infection caused by the coronavirus. As a result of this inflammatory response, the infection appears in all parts of your body and can be manifested through your lungs and your inability to get your breath, your kidneys, your heart, and especially your brain. You may experience some symptoms such as anxiety, fatigue, depression, post-traumatic stress over having had the illness at all, fog brain, fuzzy thinking, symptoms of dementia. Some people have had strokes and even psychosis. We have seen that between 30 and 50% of people who have clinical symptoms of COVID will go on to develop some sort of mental health issues. And the more we learn, the higher that number gets. At best, people just say they just don't feel right. They're just not at their best. What other psychological symptoms can we see? How about the constant fear of contagion that we see in public settings, in supermarkets? This affects our daily life and leads to social isolation and a change in our relationship with others. The prolonged stress can lead to the inability to manage upsetting or negative emotions. And we see this in our healthcare workers. They burn out. Also, we can see increased substance abuse. We have seen this, increased domestic violence, depression, and suicidal thoughts, and actual suicide. We experience a separation from our loved ones, which is very stressful. And most importantly, we feel a loss of our personal freedom. And we have uncertainty about the spread of this disease in our community, the country, and even the world. So we are left with a feeling of helplessness. Some of us have tried to solve this by running out and buying toilet paper, one of the few things over which we have control. But what kind of help is available now? Believe it or not, the online psychological and psychiatric services have taken a big leap forward. The benefits are, number one, it reduces the fear of contagion that we see in face-to-face contact. You don't have to put up the expense required to travel to your appointment. You don't have to worry about childcare while you go see the doctor. And you can see your doctor a lot faster than waiting for an appointment. And that's all I have in my time allotted, but I'll be available for questions afterwards. Thank you.
Thank you. That was great information.
Yes, thank you so much, and very practical and just down to earth. And I do want to say again, thank you to the Manats. And they're here because, as they said, they were on site at the COVID-19 testing in the African American community. And when I say they were on site, I mean, she ran the registration set there at the front. And Dr. Manat was actually in the room talking with the African American community as they came in. And so that's where those of you who have joined with us, are leaders. Many of you have been identified, but we're even going to push down even deeper and talk a little bit more about the practical of what's going on in Stark County through the Urban League and their outreach and their efforts, as well as we're going to hear from the Skills Community Center and talk about how can we get the boots on the ground in that practical approach. But for now, we're going to have some questions. And I believe, Dr. Latrice, we're ready with that, with questions. And so
for the first part of the discussion today, we heard from Dr. Arredondo and the health department, and we're just wondering if there are any specific questions, if anyone that's listening has any specific questions for any of our panelists this morning. And I actually see one. So if we could bring probably Dr. Arredondo back on stage. There's a question that says, I've read that the vaccine contains egg and possibly pork. If you're vegan and also allergic to eggs, what can be done?
Thank you so much for that question. I really appreciate the opportunity to give you some information. So the COVID-19 vaccines from Pfizer, Moderna, and Johnson & Johnson do not contain any eggs or pork at all. Once I have an opportunity, once we go to someone else here, I'm going to pull up the ingredients for each of the vaccines so I can show you what's in the vaccine so you're aware of that. But to answer your question directly at this time, there is not any eggs or pork in the vaccines, so there's nothing to worry about for that.
And Dr. Arredondo, if you're allergic to penicillin, are you okay to have the vaccine?
Thank you so much for that question. If you're allergic to penicillin, that is not a problem in terms of getting the COVID-19 vaccine either. Thank you.
Okay. Those are all the questions at this time. But still feel free to add your questions to the chat. We can address those. Go ahead, Dr. Nelson. I'm sorry.
Well, people are wondering how can they get involved, and so I think we'll have some information as to how they can get involved. And I'm just saying that they can contact either Portage County or Stark County NAACP, and we will have a way and talk about how you can get involved in helping out with this great, research that's going on with all the presenters. But there's work for everyone. So one of the things that we can do, that we can say, is that if you contact the local NAACP in your area, there's things that we can have, that we can always use your assistance. Again, we still got a lot of heavy lifting to do in our community. And I think that pretty much answers that question. We also want to say that those of you, that this is also being live streamed on the NAACP's website. And I believe it's being recorded, so we'll be able to use some of this. The other questions about using and access to some of the materials that have been shared today.
And someone is asking if this panel will be repeated. And Dr. Nelson just explained that it will be available on ohioNAACP.org to view. It's also streaming on YouTube, so you can grab those recordings and definitely share that with your professional and personal networks.
And then if we do see a need to have to engage even further, Pastor Arrington is going to be on representing the faith community. I think that there's work to do. And so again, boots on the ground. From hearing from those groups, that's there may be an opportunity for us to go back and look at doing something different in our community. And so we'll just keep working on that. There it is. That technology,
right?
But yes, it depends on the response that we get from this as to what we can do later in our community, because we're not saying we have all the answers. The reason for doing this is so that we can get input from our communities as to how and what we can do together. And so there's some different places that you can get information that's there on the screen. And as I said, out of this may come something else that the community would like to see jointly, and we would welcome that.
Absolutely. So without further ado, we'll move into the third and final segment of the series this morning.
And I'm just so excited that this is boots on the ground. And so our first speaker is going to be Miss Pam Nation Calhoun. And I believe we're putting are we going to have them together? Pam Nation Calhoun is the manager of the Portage County Metropolitan Housing Authority. And she's going to share a little bit from her perspective of working with housing and our community and some of the strategies that they've utilized there in housing. So, welcome.
Thank you so much, Dr. Nelson, for including me in this conversation. I've learned a lot. We're learning more and more about COVID every day. And every opportunity I have to hear more gives me another opportunity to get out there and provide the information to the clients we serve. So just before I talk a little bit about some of the things that we've done and lessons we've learned at the Housing Authority, as we've attempted to deal with this pandemic and now making sure there's access to the vaccination and the information is spread out there. Just a little bit about my background. I'm the executive director of the Portage Metropolitan Housing Authority, and I've served there for the past 22 years. But in addition, I'm very fortunate to serve on the Community Action Council Board for our county, and also the Portage Learning Center Board, which handles the Early Head Start and Head Start programs. I also serve on the Ravenna School District Board of Education. And I just said all that just to let you know that that experience in dealing with the populations that each of the programs have in common has enabled me to get a different view than some of the other service providers or healthcare professionals even. But at the Portage Metropolitan Housing Authority, we started last March, and we started with an education campaign. As we learned more about COVID prevention and the importance of PPE and social distancing, we engaged in a campaign. And what we did was a monthly newsletter, virtual newsletter, hard copy newsletter for those who preferred that. We also did monthly well checks. We did phone calls to every family that we served, just to kind of see where they are, what their needs were. And also, we have a lot of individuals who do not have the family support. So we wanted to make sure that if they were in a bad place, we were able to bridge the gap between them and getting them medical attention that they may have needed or other services that they were in need of. Once we did the education campaigns, we started handing out sanitizer, disinfectant, mask, gloves, different things that our families had indicated they were in need of based upon surveys that we did periodically. But where we are now, that the vaccine is available and out there, we researched and we noticed that just from our engagement with our clients, there was a significant amount of hesitancy. And from our conversations and what was shared with us, it's not only due to historical trauma, but there's also a lack of trust in the government and the healthcare system in general. So before we could even talk to them about the vaccine, we had to figure out ways to kind of dispel some of those issues and to build a level of trust that would allow them to even be receptive to the idea of getting vaccinated. So what we started doing was, again, getting any information that we could from a number of sources and spreading that. We'd go out on sites when we were delivering food and different items, and that gave us the opportunity to talk face to face with the households. And we've learned, just not only in response to this pandemic, but in general, people seem to be a lot more receptive to information if it's coming from someone who's familiar or someone that they're used to seeing or dealing with. So as we started doing that, people became a little more comfortable, warmed up to it. We partnered with the Portage County Health Department and we set up vaccination clinics. The first two clinics were held at our senior sites, Easttown and Etna. The seniors had mobility issues, transportation issues, and many of them, although willing to be vaccinated, weren't willing to invest in, okay, I'm going to have to figure out how to get there. I'm going to have to schedule the appointment. So we thought by bringing it to them, that would remove all of those barriers. Those two clinics went very well. We had at the one site probably 45% of our residents get vaccinated. At the other site, it was a little lower, 30%, but we plan on doing a second round of clinics at those two sites. And then starting next week, we are spreading the clinics to our family sites, which are located in Kent and Ravenna. And just based upon the feedback, the calls that we've received so far from people indicating that they did want to sign up for it, we are going to have pretty good participation in it, in those clinics. And we're really excited about that. But as far as where we are now, I think that in general as a community, just increasing the availability and access. We are very fortunate that we have the field house at Kent State. We have had the clinics at the Skills Center, and there have been a lot of opportunities. But now I think that for some of the special needs populations, it's going to come down to meeting people right where they are and doing things on a smaller scale. And I know that that may not be as cost effective, and you're dealing with a lot smaller number of people versus being able to vaccinate 1,500 in a day. That is how we are going to reach some of the people who still are a little uncomfortable and hesitant to get vaccinated. And then as far as our program, just a little background on it. We serve in the public housing, on the public housing side. There are 727 individuals who reside in our public housing. There are 303 public housing units. Of those, 35% are African American, 0.07% are other brown persons. On the Section 8 side, we serve 3,537 individuals, 1,746 households, and of those, 30% are Black, 20%, or I'm sorry, 0.12% are other brown persons. So just a little information on that. And as far as what we're doing, our plan of action has been a work in progress. As we get access to more information, more opportunities, we're doing what we can to make sure that those we serve are able to take advantage of those to protect themselves and improve their quality of life. So that's all I have to add for this morning. But again, thank you so much for giving me the opportunity just to share a little bit about our agency and what we've done.
Great information. Great information. And, you know, the goal of this conversation is to give community members access to some of the grassroots efforts and things that other agencies are doing so that we can take this back into our circles of influence and replicate or build upon it. So thank you. That was great information.
Yes.
Next we have I'm sorry, Dr. Nelson, were you going to say something?
Oh, no, I was going to Pastor Arrington. I thought we were moving right on through.
Pastor Arrington from People's Baptist Church here in Stark County. Welcome, sir.
Good morning, everybody. I count it a privilege, a pleasure, a joy. And I want to say thank you to Doctors Nelson and Snodgrass for the wonderful privilege of participating with this, and just to be able to throw in my 2 cents. I'm thankful for that. Just a little bit, I've been at People's Baptist Church for the past 35 years. And obviously, with the rest of us, never have seen anything like this before. And I said that to say this, that it has brought us and brings us some, it's a tremendous challenge, but it has also brought us some wonderful opportunities, of which this is one of them, being able to communicate face to face, virtually, if you will, with people that otherwise we perhaps would not have come in contact with. Now, being part of the church, sometimes people get it twisted, because everybody who is a church person, and I hesitate to say this, but I think it's a reality, is not necessarily a person of faith, because we get it twisted when it comes to our faith, especially in the context of this pandemic with the vaccinations, because sometimes people think if I have faith, I don't need science, and if I follow science, I'm not really exercising my faith. Well, nothing can be further from the truth, because, as you know, God created science, and science often confirms what God has done. And so they are not mutually exclusive, faith and science. And so at our church, we have been operating on a foundation bedrock of faith, but we appreciate and we also follow science. We've had a number of presentations made by our resident doctor, Dr. Jasmine Long, and she presented to the congregation about the virus, similarly to what has been presented to us today. So we want to keep our congregation informed. She's also presented to our women and even to one of the sororities, I think. And so we've tried to be actively involved from the beginning. Even when it came to social distancing, we've not stopped meeting on Sundays, but we have employed the social distancing techniques and the guidelines from the CDC because it is important. And yet we operate in the context of our faith because, God is in charge of all of it. And I think that's why we have so many wonderful opportunities before us when it comes to dealing with our community, especially. This is a time when, because we got a lot of issues, and I heard the doctor talk about the questions that people are asking, and some of the questions that they're asking um, to some people may be no-brainers, but because of the influence that we are under and have been under, thoughts and questions like these arise. And so I'm appreciative of being able to hit this from all sides. We want to make sure my wife and we got our second shot. We had it on the 5th of March, and we had very little reaction, just soreness and that kind of thing, but nothing major. And we encourage, since we've got a significant senior population in our congregation, most of our senior members have been vaccinated. And because of the program that we tried to promote, one of our members, Mrs. Cleo Lucas, has been working closely with Jim Adams at the health department when it comes to equity, especially. And there have been a number of clinics that have been put on at the Civic Center, at the Southeast Community Center. And so we've been involved with that to try to make sure that people get their vaccination. And listen, people of faith should be the first in line, I'm thinking. Okay, now, that don't always work out that way, but should be the first in line because, if we really are trusting the Lord, just like the pandemic itself, whatever it is, He's got all of it. And for those of us who are people of faith, we trust Him no matter what the situation is. And so, even though we are people of faith, we also listen to the experts and trust the science of it because the science comes from the same foundation upon which our faith is built. And so, therefore, we try to eliminate those things that will make us afraid because, again, our faith say God has not given us the spirit of fear, but of power and of love and a sound mind, which means good sense. And when I look at this thing, this is personal, y'all. I have over 550,000 reasons for taking the vaccine because those people have expired. And this thing is real serious. And so, we want to encourage as many people as possible. I certainly don't want to sound flippant or even dogmatic about it. But I want to encourage us at the strongest possible level because if, again, we're people of faith, whatever it is, the Lord has got it in his hands, and we're trusting him above anything else. But he always uses his creation to promote his agenda. And so we want to be faithful to him, but we also want to trust who he uses. And doctors and nurses and scientists and caretakers and all of those people, they are in the realm of his creation that he's using for his glory, but he's also using it for our good. And so I'm thankful to have this opportunity to encourage people. If you haven't made a decision to get the vaccine, please do that, because you're important to your circle of influence and your circle of contact. And sometimes, yeah, I want to say this, and I don't want to be offensive when I say it. I think that sometimes when we make decisions like this not to do it, it's really selfish. We're only thinking about our own perspective when we really ought to be thinking about others. And so, in part, number one, yes, we do think about ourselves, but we also think about others. So when you put it together, it is a wholesome type of decision. And again, it's of a sound mind. In other words, it makes sense that we get our community vaccinated and that we go forth moving toward better health. I'm not finished. I'm just quitting.
Well, let the church say amen. We definitely need that information. Definitely. Thank you, Pastor.
Thank you.
So next, we will hear from Skylar Park. So we think about the Generation X and the Generation Z, and like, how do we encourage that population to obtain their vaccinations? So Skylar is, he works with the Park and Recreations Department as the Director of Youth Development. Skylar, did I get it right?
Formerly youth development. Now I'm the adult and youth sports supervisor.
Okay, but Skylar is in that space. So today, Skylar is going to, talk to us about reaching that community, some of his personal perspective, and how we can go about, ceasing some of the hesitancy within the voice. He's the voice of our future. So what do we do to tap into the Gen X, Gen Z population, Skylar?
Yes. First, I just want to say thank you for allowing me to be on this to speak from my perspective, coming from the youth. I was listening, to all the statistics and all the doctors and psychiatrists and people speak prior to me having this opportunity right now, and they just gave a lot of insight, a lot of knowledge, and I think that's one of the first steps. People in my age bracket and younger, I'm 26. Just getting out and getting the information. I believe there's definitely a stigma or just the air about, the negatives that getting the vaccine can provide. I hear a lot of people just blankly saying, I'm not going to get that. I don't want to, something to happen to me or worse. A lot of people think there's just like a death note attached to, getting the vaccine at the younger age. But I think that just goes to not having enough information. It's definitely out there for them to research and find. They just have to go get it. So platforms such as this, presenting that information in a very clear and distinct way, definitely helps to that. For me, I was hesitant. I was one of those people who didn't think I needed to get the vaccine. I don't really get flu shots. I don't really do things like that, but I just had to put a lot of things into perspective. COVID's not going anywhere. It's going to be here. So what can we do to prevent it? We're all tired of, being tied, not being able to do certain things that we're used to. One way to get back to that is everybody take care of themselves with the vaccine. Another perspective is, I have a lot of elderly grandparents, and I help take care of them, so I can't really be around them if I'm not taking care of myself. So I needed to make sure that I can provide the proper care, my grandparents, be around my family, and feel comfortable at the same time. So a lot of those things weighed on my decision. And ultimately, I just thought it was what was best. I think, I did the research properly. And I just got to a level of comfort in my head where I'm like, well, all the things that I thought prior to getting this vaccine aren't really valid. They were just things that were either, posted on social media and I took it and ran with it without doing my own research, or, it's just a lot of people saying the same thing over and over again in certain spaces. But them not really knowing all the information, so I think just getting the information out there for sure to people in that younger age bracket will help them, release some of that apprehension that comes with, the vaccine itself. But, kudos to this right here, this moment that we're having, and more moments like these. I'll continue to encourage my peers and people that I see, whether it's at the community center, as you mentioned. I work for Canton Parks and Recreation, and we're housed at the Edward Peel Coleman Community Center, or the Southeast Center. So I see young people all the time. I talk to them about a lot of various different things, and obviously their health is one of them. This conversation comes up often. So I'll definitely be sharing information about that, encouraging them to not only take care of themselves, but take care of other people. It's not more so yourself. You may not get sick, as I heard somebody mention earlier. You may not be the one that may face grave illness, but you passing it to somebody else, and them contracting COVID off of you could end somebody else's life. So those are things that people need to think of. It's not just about you, it's about the safety of others as well. But I think that's, I think I covered it, my perspective. But I can touch base on anything else if you want me to,
Great job, Skylar. Thank you for, being a health ambassador. To you and also the other panelists and those listening, we do have a toolkit that has some great resources, some flyers, some links, some great information that can arm you with, going back into your circles of influence and having these conversations. So thank you for spending time with us this morning. We appreciate
go back to Tyler. Tyler, you have an MBA, so and I always say, you're bringing your A game. So you have your MBA, and where did you go to school?
So I went to Walsh University. That's where I got my bachelor's and also a master's.
Very good, and you need to say that because we love to see our African American men who are continuing their education. So thank you.
Sure.
And thank you. Continue to take your skills back into our community. We don't take that for granted. Okay, Dr. Latrice.
All right, so thank you, Skylar. So next, we will hear from Ms. Diane Stevens Robinson, who is the interim CEO and president of the Greater Starr County Urban League, and she is doing some great things in the community. So we will turn it over to Ms. Diane to speak to us on her perspective and some of the work that's taking place in the Urban League around vaccination, hesitation, and equity.
Well, I would like to begin by saying thank you to Dr. Snodgrass and Dr. Nelson for the work that they're doing, this most important work and at a critical time in our communities and our lives. Thanks to the NAACP for hosting today's Train the Trainer community outreach session. This has been a truly informative session, but it has been scientific, and we just had a spiritual aspect of it also. And so when we walk away today, we will walk away well informed in that lift of spirit that makes such a difference also. Another piece of this is that I would like to say thanks to the mayor for his participation in support of this project, Mayor Burnaby, and to Jim Adams and all of the others that have shared such great information and from different perspectives. I have to lift Jim Adams's name in that the work that the Canton Health Department has done in our community has really been very good. And Jim was on here, and then I know too that our council person, Chris Smith, mentioned him, but there is a reason, and that is true to the fact that they established an equity clinic to help make a difference where that disproportionate impact of COVID on individuals of color, specifically Blacks, African Americans. And so, as mentioned earlier, Canton is somewhere around 23% Black, and the Equity Clinic set aside 20% of their vaccine so that we could recruit and sign up individuals of color. And so the Urban League, along with NAACP, the pastors groups, had that opportunity to recruit individuals and say to them how important it was for them to have that COVID vaccine, but also provided a way to move them around the challenge of trying to go on site to register for the vaccine. And it also moved them around the challenge in many instances of having transportation to go in for the vaccine. The vaccine has been given at the Southeast Community Center, and we've had several sessions there. The first vaccine was given at the Southeast Community Center on March the 4th, and the second shot was given on April the 1st. And since then, the first vaccine has been given again at the Southeast Community Center, again, making it easily accessible to many in that community. I would like to share with you some other things that the Greater Stark County Urban League has done in the community to address the challenges of COVID. A little over a year ago, whenever we understood the challenges of COVID and how important it was for individuals to have household cleaning items, the Urban League set up a household and hygiene distribution program. And that program was to address the needs of those that were in poverty or had been highly challenged by losing their employment during COVID. And then after that, the Urban League was able to put into play a food giveaway, and we're still doing that. And that food giveaway just began in February, but we've been able to give food to individuals that, again, have been challenged by COVID. And between the months of February and March, and we gave away 8,000 boxes of food. Today will be our first food giveaway in April, and we'll give away another 2,000 boxes of food. So anyone can get the word out that there is food being given away at the Greater Stark County Urban League, which is located in the Southeast Community Center. There will be another food giveaway on the 24th of April. And so, again, those are some of the things that we're doing at the Urban League to help with the COVID. Most importantly, at this point in time, we want to get the word out to absolutely everyone that they can call the Greater Stark County Urban League or go on our website so that they can get us the information and we can work with the Canton Health Department to register to schedule these individuals for the COVID vaccine. We've worked through churches to register individuals. We've worked through the various organizations, again, such as NAACP and the pastors group. And we've worked through families, friends, and through social media. And we continue to post the information with regard to the work that we're doing there at the Urban League. Again, it is critical that we continue to get the word out to the people and dispel the great concerns that individuals have. And you are doing that. I was really pleased to hear that individuals will be able to go in and see what has been shared with everyone and to have many of the questions that we all have answered. I've had the COVID vaccine. I've had both shots. I had the Pfizer vaccine, and my husband has had the vaccine. He had Johnson & Johnson, and neither of us experienced any real challenges, maybe a little soreness in our arm where we had that vaccine. But when you really think about it, that was nothing to compare to the fact that we can be more comfortable in going out into community. It doesn't mean that we're not wearing our masks, and it doesn't mean that we're not consistently following guidelines, but there is a freedom that comes with knowing you've had your COVID vaccine.
Yes.
And so it really does make that difference. And I have to tell you, I've lost a loved one to COVID. And I was saddened to know that he had not been able to get his shot, had not at that time, and it was out of state that it happened. But again, I implore absolutely everyone to go and obtain their vaccine, but also to look and to follow their mind in finding the information. You know, the more informed we are, the better decisions we can make.
Yes,
Diligently to make sure that everyone has that much needed information to make an informed decision. And again, I thank you all for the work that you're doing. And if there's any way that we can continue to support you in this work, please contact the Greater Stark County Urban League. Contact me. You know, I know both of you well.
Yeah.
So please contact me.
Thank you so much. Our time is running short, and we have one more presenter. We also have some questions. And so now Mr. Frank Hairston is going to come and he's going to share with us. Frank Hairston has done work, he's with the Portage County Mental Health Board. He's also with Portage County NAACP. And he's coming to share as a person who worked with the Skills Community Center in the African American community.
Good morning. It's a pleasure to be here this morning, and I am so thrilled that be able to tell the story about the Skills Community Center and the Portage County community. So as we know, over the years, so many things have happened, and we keep hearing the same thing about our community, that Black people did not want to take the shots. We had so many problems that, you know, but in my community here in Portage County, especially in the Black community, that was not it. I received a phone call from a lady that I respect and love, and she was crying, and she said, and she calls me Frankie, and she says, I don't want to die from the COVID. Where can I get a shot? And probably 2 hours later, I received a call from a gentleman. His name is Ariel Sanders. We call him the mayor of McAlrath. And he said, Frank, we have no idea what we need to do. Where can we get a shot at? So, you know, I sat back in my chair and I said, Lord, what do you want me to do here? What should I do? So, Pastor, I know you're still on the line. I got that 3 o'clock call from the good Lord, and he said, this is what I want you to do, young man. I want you to call the Portage County Health Department. And I did. and I talked to them, and they gave me a person by the name of Becky Lehman to work with, and what he put in my head to tell her is that I was willing to work with them if they would send me information, flyers, anything I could get out to the churches, the community centers, and to our Black politicians to get the information out there about the COVID shots and what was going on. And he also put in my head to tell her that we were willing and open to having a site at one of our community centers at Skills Community Center. And so she called me back in a couple of days and said, we're excited about doing this. We want to do it. How can we do it? I said, I'll get back with you. I contacted Sharon Sanders, director of Skills, told her what the opportunity, she was excited about it. The next people I called were Dr. Manaz, because I needed them there because of the respect that they had from people in our community, and they wanted to be part of that, and they did. They worked hard, and it meant a lot to the community. The next person I called was Dr. Nelson, NAACP, and she was excited. And matter of fact, she even got her shot at the community center. One of the things that happened was that we were able to get the information not only in the Ravenna Township communities, but Kent, Streetsboro, Aurora. We had people coming from all over our county, from the Black in areas to the community center to get the services they need, and we were very thankful for that. And as Dr. Manat said, that it went very well. And we're happy about that. And as I said, I called Becky Lehman, and I told her after we had just finished our two clinics that we're open for more. She says, well, we're going to open them to bigger sites. I informed her that that's fine, and I'm all happy for that. But there are people in our community that we need to nurture, and they feel more comfortable coming to our community center, that we need to keep those things up. The other thing I said to her was very important, and I hope that the NAACP, the statewide, will take this into consideration. We have got to continue to market and put stuff in our own communities to get our people to do things. That's where we are right now. Yes, we're having the big vaccinations. We got the big one at the field house at Kent State University, but we still need to do stuff in our own community. We still need to nurture our own people and have clinics. And Dr. Nelson has been pushing me because she wants to have some in Kent and a couple other places. She was excited to see how it went over at Skills, and we want to do that. So there are still ways to do that. As I said, I'm excited about what happened in our community. Very pleased with the Portage County Health Department, but we can continue to do more, and we need to do things in our own community. And thank God we have doctors and other folks in Stark and Portage County who people respect and love and trust them that they will come. And that's what the Monats did. That's why I had to have them there. And people really responded to that. So I have some other things that I love to talk about. I know we're running short. Some ideas for the future, because guess what? This COVID ain't over. It'll be COVID number 2, 3, and 4. And we as a Black community, and we have poor whites that follow us too. We have people that need our guidance, because when they say this is all over, it ain't over. Are we going to be prepared as a community for the next step? God bless y'all. Thank you. And I have a lot more to say, but I know you're running out of time. So thank you.
Thank you. And one of the things I do want to say is that they called directly. I think that was one of the important things is for those appointments, they called directly to Sharon Sanders. So yes, there was the between. And then those names were given to the Public Health Department in scheduling.
Right. And we continue to do that. And right now, even though there's no clinic set, we inform people in the community through the churches and community centers. Please call Sharon. I call her our navigator, and she contacts the health department and make sure that those people who want to get shots or whatever guidance they need, that we continue to do that. But we like to do more. We want to have some more clinics. We like to continue to put information out the best way we can. You know, if it's in our the Portager, our newspaper, or the Record Courier, you know, we need to continue, because right now we're at a critical point. we've done the older folks, people like me, I'm 68 and above, but what about these young folks who really don't want to, they're hesitant to do something. We got to keep educating them. We got to keep doing things. God bless you. I'm sorry if I took too much time.
You're fine. For touching on the access component, because that's critical. That was a part of bringing the A game, talking about what community is doing and helping to replicate some of these endeavors. So thank you so much. We're going to go ahead and move into some questions now, because there are some really good questions within the chat, and we want to make sure that we get you those answers. So the next question is, how effective is the Johnson & Johnson vaccine?
Great. This is Dr. Arredondo. Do you mind if I take that question?
Absolutely.
Okay, great. So the effectiveness of the Johnson & Johnson vaccine is 66% for moderate to severe symptoms and 85% for severe symptoms. And I'm going to see if I can share my screen just briefly here, because I have some other information to answer the questions. Give me just a second to get set up here. Do you see my screen here from the PowerPoint presentation?
Yes, sir.
Okay, so just at the very bottom, and I will email this presentation so you have that. So that is 66% effective against moderate severe symptoms, infection, 85% against severe infection. And I was looking in the chat, it looks like there are some other questions. I did want to get back to the question regarding the vaccine ingredients. Can you see my screen here regarding the ingredients?
Yes.
Okay, so again, I will email this out, but these are the exact ingredients within Pfizer, for Moderna, and Johnson & Johnson. And I'll send this out, and here's some links that I'm going to have also at the bottom for you. And what I did is I went to just Google, CDC list of COVID vaccine ingredients. And in there, you'll see that it has links to the information about each of the ingredients. I'm going to click on these links. So this is about Pfizer. So again, in terms of the previous question, it does not contain eggs, preservatives, or latex, excuse me.
Okay.
Moderna, same thing. Again, does not contain eggs, preservatives, or latex. And for Johnson & Johnson, the same thing here. I also did see some questions regarding the safety of the COVID-19 vaccines for those who are immunocompromised. I'm showing you where I got that information. Just go to Google, put that information there, or something very close to it. And you'll come to this page here, interim clinical considerations for use of COVID-19 vaccines, currently authorized in the United States. And then I open that page up further. Underneath this section, considerations for vaccination of people with certain underlying medical conditions. I summarized it here, and I'll send this out as well. This is directly from the CDC. So people with HIV infection or other immunocompromising conditions, or people who take immunosuppressive medications or therapies, might be at increased risk for severe COVID-19. So currently there's no data available to establish COVID-19 vaccine safety and its effectiveness or efficacy in these groups. However, the currently authorized COVID-19 vaccines are not live vaccines, and therefore can be safely administered to immunocompromised people. And so that was that information. There was another question regarding if someone had their sinuses removed, could they get COVID-19? And they can get COVID-19. So COVID-19 is a respiratory virus that is spread usually through coughing or sneezing, talking, laughing, those kind of things. And the spread of the COVID-19 is through the respiratory system primarily. So even if someone had their sinuses removed, they could still unfortunately get COVID-19. I think that was the 4 questions that I saw in there, unless there were any others.
It was great. Thank you. That's excellent information.
Great.
And I just want to say a very special thank you to all of our panelists for an outstanding sharing of information. And I wanted to do a screenshot. I got my screenshot. But one of the things I also want to say is that I'm sure that there's going to be some other things that we're going to be doing together. This is probably not going to be our last rodeo. And so we need to take the show on the road in particular and do more to educate all communities. As we were saying, we have our rural communities that we're also working with. And I want to say to those who are joining us, I did get, I know about 40 others who are out there, just a family of 40. And so we are going to be sending out those who've gone through this training an ambassador. We want you to become a COVID ambassador in partnership with the Ohio Department of Health and the NAACP of the state of Ohio. And so we just want to make sure that we have everyone's email address who's viewing this presentation. If you could just make sure that we have your email or contact information, because we would like to send you a certificate. And I know I just got a text, someone is viewing it via Facebook. And so we may not be capturing all that information, but a very special thank you to everyone. This has been awesome. And just continue to do the work that we're doing and that you're doing. And I'm sure that we're going to begin to continue to see the progress and the efforts of your work. Pastor Arrington, we're going to have to do a little bit more, work a little bit more with our churches, and maybe even looking at how we can do some partnerships between the churches and getting, the faith-based. And so maybe doing something similar to this with the faith-based community, with our pastors. I know you serve Pastor Arrington on a committee with the pastors in your area. And so I think that's going to be the critical push down lever for us. And I cannot leave without saying, if you're not a member of the NAACP, the baddest civil rights organization in the nation, we invite you to join us. Applications are all on our websites, and we need the work of everyone. And we want to say a very special thank you to our production team. And Tiffany has joined us. Tiffany is with the state of Ohio. Well, introduce yourself, Tiffany.
What an amazing, amazing event. So just wanted to say thank you so much to the doctors who made all of this so impactful. Dr. Geraldine Nelson, Dr. Latrice Snodgrass, all of our presenters, but a special thank you to our state conference president, Tom Roberts, and all of the things that he's done, along with Chief Jamie Carmichael to make this possible. So thank you so much to everyone, to all of our presenters for that amazing information. Please make sure that you go to www.ohnAACP. If you're not a member, you can join and get more information there, as well as how you can become more educated on vaccination hesitancy. It's very important that everyone have the facts about the vax. So again, www.ohnAACP.com, as well as the Portage and Stark County NAACP websites, as well as their Facebook posts and Facebook pages. Please make sure that you like them, that you are staying up to date with that information as well. And again, doctors, what an amazing job you both did today. Unbelievable. Bravo, bravo, bravo.
Thank you to all of our panelists and everyone. We'll be getting the information out to you. If we don't have your email address, please get that to us, because we do want to share the toolkit with you that was developed by Closing the Gap, which are a consulting group obtained by the Ohio Department of Health. So we definitely want to get that information to you. Thank you, and have a blessed remainder of your Saturday.
Thank you. Bye.
Bye, Dr.